Somebody had a question on Twitter about the question of selling across state lines, and there were 4 points here. Let's listen to the guiding principles, the 5 principles that Donald Trump lays out here, and I will just go through these briefly, and why this is going to be a disaster and can't happen. Or if you got to parse, remember, Bernie Sanders told us what access means. You all have access to buying Donald Trump's homes. All you need are millions of dollars or the ability, to be fair, to go to a bank and borrow millions of dollars.
We have access.
Here is Donald Trump talking about what he is promising when it comes to the Republican health care repeal and replace plan.
Here are the principles that should guide Congress as we move to create a better health care system for all Americans. First, we should ensure that Americans with pre-existing conditions have access to coverage and that we have a stable transition for Americans currently enrolled in the health care exchanges.
All right, pause it. So access to coverage. In other words, prior to Obamacare, if you had a pre-existing condition, you could be denied coverage and there could be no place for you to get it. Now, in 35 states as of 2011, 2008, 34 states, I think it was, there were high-risk pools which served state high-risk pools, 200,000 people. You've heard these numbers. I've told you before. There are, it is estimated that the number of people with pre-existing conditions in this country that would be, is somewhere between 20 and 30 million people. Okay? So they're basing that, their pre-existing condition on a system that could only sustain 200,000 people because the premiums were so high. So you have access. You just may not be able to afford it. Next up.
Secondly, we should help Americans purchase their own coverage through the use of tax credits and expanded health savings accounts. But it must be the plan they want, not the plan forced on them by our government.
Okay, pause it there. So now what they're saying is health savings accounts, which are really helpful if you're rich, because you get a tax-free way of saving money and you can use it as you want. You can sustain more risk because you're rich, perhaps, for health care. Tax credits, unclear. This is going to be a big fight in the amongst the Republicans, whether or not this will be a refundable or non-refundable tax credit. So, in other words, a non-refundable tax credit is if you owe the government $1,000 in taxes, and you get a $1,000 tax credit, non-refundable, or let's say a $1,500 tax credit because you've paid for health insurance, you get $1,000 off your tax bill, period. But if it's refundable, you actually get a check for $500 back from the government. And that's a big fight, but that's basically what is known as a subsidy that exists in Obamacare. And some Republicans don't want to just replace Obamacare with Obamacare when it comes to subsidies. Others do. But the second part of what Donald Trump there said was, we're no longer going to mandate to insurance companies that they actually sell a product that does what it purports to do. So the idea of the patient's bill of rights, that your health insurance can't have caps, annual or lifetime, that it must cover X, Y, and Z to constitute legitimate health insurance, that's going to be out the window. So people can sell you something called health insurance, but when you need it the most, it very well may not be there. Continue.
Thirdly, we should give our state governors the resources and flexibility they need with Medicaid to make sure no one is left out.
All right, pause this. Now, this is where it gets really tricky, because what Paul Ryan wants to do and the rest of the Republicans in Congress is they want to block grant the states Medicaid. In other words, here's a fixed amount of money based on how many people are in your program today. And this is a fixed amount of money. So if you have more people who need to be on it in the future, because let's say we have a financial crisis, or if the cost of health insurance increases, and it went up by 50% from like 2002 to 2010, if it increases, you're SOL. And it also allows you, as a state governor, to say, screw it. We're not going to cover as many people on Medicare. Instead of going up to 133% of poverty for states that are already covering all those people, or even 100% of poverty, we're going to drop it down to people who are living at like 70% of poverty, and we're going to use the rest of the money to offset tax cuts. And just to give you a sense of how bad of an idea this is, and while it's unsettled, is because guys like John Kasich, Republican governors, don't want these funds cut. They don't want the Medicaid provisions cut because it's working in their state and they're saving money. Continue.
Fourth, we should implement legal reforms that protect patients and doctors from unnecessary costs that drive up the price of insurance, and work to bring down the artificially high price of drugs and bring them down immediately.
All right, that's fourth. Now, what he's saying there is medical tort reform, which has been proven time and time again to have no bearing on the cost of medicine. You can see that Texas has rolled back has implemented medical tort reform. And the idea that they should drive down the cost of drugs, how should that happen? It's a nice idea.
Do it. Just do it.
You can tell they tacked that on to number 4, right? They wanted 5 principles. Tort reform and driving down the price of drugs. Not clear how that happens. I guess unless, of course, you're saying to drug companies, you're no longer going to be subject to lawsuits when, let's say, that drug that you started selling off-label ended up killing people.
So this is great. So now we can boost prices and still be not accountable in even new ways.
Well, but you should drop them.
Totally should.
And number 5, here's that one that I got the tweet about.
And finally, the time has come to give Americans the freedom to purchase health insurance across state lines.
Now, this one gets a rousing applause from the Republicans because it's part of their fantasy life that somehow, if you sell health insurance across state lines, you're going to create more competition. But the bottom line is, and this is, and you can hear this from conservative healthcare and insurance analysis, that the reason why, and there's about 4 or 5 states that already allow cross-state purchase of health insurance, but the health insurance companies are not interested in it. Remember, I've told you there's 2 types of insurance in this country. There's the employer insurance, which in fact does not involve the insurance company in doing anything other than administering the health insurance. The employer pays for it. Premiums pay for it. They don't have any money that they're risking. It's not risk control, it's administrative. The individual markets, the reason why insurance companies are neutral at best about the ability to sell across insurance state lines, and are probably a little leery of it because they want it to be out there as if it sounds like it's one of the problems, is that they know that they would have to go in and spend a tremendous amount of money to build a network of providers. They have moved over the years from a volume business to an outcomes-based business. In other words, you get paid based upon how healthy you keep your patients, not how much service you provide. And this requires a lot of technology and a lot of awareness of the environment in which they're selling it. So they're not terribly interested in it. But it is this myth. And the only problem from a liberal perspective on why this would be a problem is that because the Republicans, I think it was in principle number 3, are going to get rid of the patient bill of rights, saying that insurance has to be actual health insurance that helps you, is that if you have every state deciding their own, insurance companies are all going to try and base themselves in the state that basically says you can sell a car without an engine and call it a car. But if you were to have the controls of a patient bill of rights across the states, allowing for this cross-state insurance business, it would be fine, and nothing would change because the insurance companies themselves, it's not regulatory that's keeping them from doing this. It's their own business models. So, what's that?
I can see Trump. It's not up?
There you go.
I can see Trump personally jumping into the insurance game.
I will. I'll sell it.
As soon as the standards get lowered enough, it's the new, it's the Trump University of Healthcare. There you go.
Trump University Insurance.
Trump Care.
The look on Paul Ryan's face during that whole thing just tells you that, I mean, anytime he looks like that, you're just going to, you're going to die.
I'm orgasmic.
Exactly.
There are children that are going to starve. It's almost like, the Obama speeches when he would really start to, sail, where he just got more people have health care.
And
There's
Joe
more
Biden
opportunity.
would just be like, giddy.
Yeah, but it's like Ryan's just like, more children are going to suffer, and more minors are going to have black lung disease, and more rivers are going to be polluted, and the Koch brothers are going to have even more couch change in the millions. That's the America I see. That's what we're fighting for.
I think it's like his look definitely goes from that, like the cat that ate the canary, to just sort of looking at the back of Trump's hair and trying to figure out what's going on there.
This is fascinating. What's actually happening there? Oh, more kids are poor. Great. Let me stand up for that one.
That's
all right.
wonderful.
And then
All right.
Pence is there just like, it's the Lord's plan.
Hey, it's Sam Seder. Why don't you subscribe to this channel? You can do so right over here. Subscribe.